Yes.
I'd like to welcome everyone to the Public Safety Committee meeting, regularly scheduled Monday, August 15th, 2022 at 5:30 p.m. Having called to order the meeting, I'd like to see if there's a motion to approve the minutes of both the meeting of June 20th and July 18th.
Motion to approve the minutes of meetings of June 20th and July 18th.
Can you break those up, because I need to abstain on one of them?
Yes. Motion to approve the minutes of the meeting of June the 20th.
Second?
All in favor?
Aye. Now, motion to approve the minutes of the meeting of the July 18, 2022.
Second?
Okay.
All in favor?
Aye.
I
Okay,
abstain.
both. And one abstention for the 18th. The meeting, the public safety meeting is open to the public, and I am wondering if we have any public in queue. I do not see any. Anybody in the audience? There's no public comment this evening, so we will move on to departmental updates, starting out with fire. Chief Garahy.
Thank you, Ed. So for the month of July, we responded to 56 incidents, brought our year-to-date to 365, still slightly less than last year at this time. Our training hours recorded were 261, and that brings us up to a little over 2,400, which is slightly above where we were this time last year. And we had no injuries reported in the month of July. Personnel, we're at 62 active. We had one resignation, and we brought one new member in last month, so that evened out. And moving on to my other sheets here, since our last public safety meeting, we continue to fine-tune our COVID precautions. We base our restrictions on the current state or CDC guidelines. And we're in the process of updating now based on last week's guidance. We just haven't completed it yet. In June, as I previously mentioned, we had a ConOSHA visit and went very well. We've now submitted our hazardous communications plan. We submitted our infection control plan, and our hazardous communications plan should go in tomorrow. July was the first month for the limited access highway reimbursement program with the state, and it's going well. We had 7 billable responses in the month of July. And training for the month of July, we had 3 weekly drills, and the topics were hydrants, water supplies, live fires with the gas props, and ropes and knots. Additionally, 3 members have been enrolled in Firefighter 1 certification school, which begins later this month. In addition, we did have drone training in a joint effort with the police department. Our officer development program's going well. As stated last month, the goal is to ensure officers and future leaders are receiving supervisory and management training to aid in the responsibilities of leading membership on and off the fireground. The training is provided outside of the normal department training and held monthly, and this month's topic will be recruitment retention. With all that said, and I did mention it previously, we had 261 training hours for the month. So under facilities, quartermaster and recruitment, we're replacing our multi-gas meters for monitoring hazardous atmospheres, oxygen content, carbon monoxide, lower and upper explosive limits, etc. The meters which we're using now are becoming obsolete and breaking down quite a bit, and we're barely finding parts, and when we do, it's through the internet and, however we have to do it. So we've got the new meters on order. They should be in shortly. The new gear dryer was received back in June, installed last week. And our recruitment team has been out at the farmer's market, and we actually generated some interest last week at this venue, and we're going to keep on going there. Also, Rocky Hill initiated an area-wide recruitment committee with the neighboring fire departments, and this is in an effort to pool resources and share concepts. We have plans to apply for a recruitment grant from a regional standpoint. And hopefully, as we continue with these meetings, we can learn from each other. From a public relations standpoint, we had a lot went out on both social media and with PSAs. And also, and we're excited about this one. And lastly, we're partnering with the library to provide prizes to the winners of the summer reading program. First place winner will receive a ride to the first day of school in a fire engine. And the runner-ups will be invited to tour the fire department's training ground, and will also conduct some demonstrations up there for them and their families.
What age group is targeted?
This is through the library, so it's elementary school, K through 5, I believe.
You're hoping there's,
Earl Sullivan.
you're hoping there's a senior division for that, so we can qualify?
We'll do whatever you need, Bill.
Just
Read my mind.
Just two questions, Chief. So on the reimbursement from the state for interstate incidents?
Yes.
Is that like a fixed fee per incident, or is it kind of varied depending on how much apparatus you have to deploy, that kind of thing?
It's written very loosely, but we're treating it as a fixed fee per incident, and we're applying for $500 for each incident. So July's total was $3,500.
Okay. And that's triggered by a request, I guess, from
It's a request from state police. It might be a 911 call into our dispatch center. There's a number of different ways it can come in. It can be a request from another town. We actually were requested to cover Cromwell on one incident.
Okay.
So we apply for when we're there, we apply for it.
So far, so good. And another totally unrelated, you made reference to drone training?
Yes.
Is there like kind of an industry out there now of experts specific to fire departments on the use of drones to assist with what you do? Things, I assume it's things like identifying hotspots on roofs, that kind of thing? Is that what you're looking to use
It's
them
a
for?
little bit of everything, and I think Chief Custer's going to help me a little bit on this answer, but from the fire department standpoint, it's anything from hotspots to situational awareness, overall views of the fire scene, right down to searching for missing persons. Now, we've also partnered with the police department where if we're using the drone on a fire scene, police department personnel will assist and run the drone, and vice versa. If we're using it, or if it's needed on a police scene, we'll run it for the police. And
So is that training coming from outside, or is that you kind of figuring it out yourself? I'm just wondering if there's some new state-of-the-art out there that we can maybe learn from.
From the fire side, there is a statewide task force that's run by the Commission on Fire Prevention and Control out of Windsor Locks. We have 2 people as members of that. From the police side, I'm not too sure.
Bulk of our training's been self-training. The officers had to go through an online certification course and process to get their drone license. But beyond that, I don't think they've brought in any outside agencies that I'm aware of.
Okay, thanks.
Councilor Prakash.
Yeah, thank you. Chief, can you give us any update on that fire on New Britain Avenue, the big fire we had like a couple of weeks ago?
Yeah, and that was August 5th at about 10 minutes after 8 p.m. We were called to 295 New Britain Avenue for passerbys reporting smoke coming from the structure. The first 2 officers entered the structure, and we had signs that it might be occupied. First floor lights were on. There was a car or a pickup truck in the driveway in the back, and it was 3 people by a vehicle inside, and it's a long driveway, so they were about 100 feet in over to the left, saying that they thought there was somebody inside there. And they checked, but they couldn't find them. We progressed as if it was an occupied structure. The first two officers there went in and did a quick primary search. And the engine out of Station 2 was the first on scene, ladder truck out of Station 1 second, and the third on scene with additional manpower was the engine out of Station 3. The search found nobody. The house was vacant or unoccupied at the time. And we did, because of the temperature that day, that was one of those 95-degree, 95 humidity days, we brought in the Task Force 51, which comprises of the towns of Rocky Hill, Cromwell, Berlin, Newington, and Weathersfield. Because of the location of the incident, Berlin and Newington couldn't come into town without passing the incident. We had the road closed. They were perfect to use at the incident. We had the town covered by Weathersfield and Cromwell. They were helpful. I mean, it takes a lot out of you being in that heat, in gear. The air packs provide you with dehumidified dry air, so you're not getting any moisture out of the air. So that actually dries you out quicker. So the help on the scene was very much appreciated. It was a very, very quick knockdown of the fire, deemed it under control, I want to say by 35 after 8. So about 25 minutes from time of call to under control. And the fire marshal is here if he's got any comments on that.
So we finished our investigation today.
Rich, I think you might want to go to the mic because thank you.
Fire started in a bedroom on the second floor, and we evaluated pretty much the entire contents of the bedroom. There was nobody home at the time of the fire. In fact, the property owner left the Thursday before to go on vacation. He was in Westerly, Rhode Island, which kind of hampered the investigation because we couldn't get consent to search. So the following morning, we started the investigation at about 6:30. We got our consent, and we dug the contents, excavated the entire bedroom, and found that there was a circuit on the far side of the bedroom that was serving a fan next to the bed that the resident left on. And we were pretty confident after today that the plug that plugged into the extension cord was loose, and there was a lot of arcing there, which being run under the bed caught the bedding materials on fire, and it went from there. So we're pretty confident that it was electrical in nature, and we got that confirmed within 95% with the insurance company this morning. So it's really a closed case at this point.
Is that a livable dwelling now? Okay. This has, sorry.
Councilor O'Sullivan, this will show up in next month's report because it's an August event. Yep.
No, so just curious, so was there damage or wear on the cords, or is just this simply not firmly inserting it into the extension cord?
When we examined the outlet for the lamp going into the extension cord that was run under the bed, after we excavated everything, we had determined that that was really basically the point of origin, and then did some further checking, and the insurance company came out today with their experts and pretty much confirmed what we thought.
No, here's my question, though. You said that you thought that the cord attached to the lamp was not firmly attached to the extension cord. And my question is, were those cords damaged or something, or can you have two perfectly good wires, one from a lamp and extension cord, and if you don't put it in firmly, you can have the situation you're talking about?
So the lamp plug that plugged into the extension cord was pretty much non-existent, and then we analyzed the burn patterns that were on the wall and the floor, and everything went right back to where they were plugged in, and then we looked at the extension cord some more. We evaluated the circuit breaker panel, found that the circuits for the bedroom were all tripped, and then kind of concluded from there.
Okay, I'm not quite getting to my question, though.
Yes, there was a lot of damage to the cord from the lamp.
Okay, that's what I'm saying.
Yes.
So I'm just wondering from a public safety or information standpoint, if you have two perfectly good cords, but you don't put them in firmly, that
Well,
can cause a
never
fire.
run an extension cord under a bed or under a
That
rug.
too.
That's
Okay.
number one.
Yeah.
But always check to make sure. And if you're going away on vacation, unplug everything.
Right.
Even your garage door opener should be unplug, your coffee maker, unplug everything.
Okay, very good, thank you.
Okay.
Thank you.
Any more questions? Go.
Thank you.
All right. Yeah, I will just comment that Councilor Prakash and myself were fortunate to be out on a ride with different police officers at the time, learning about what they do when the call came in, and so we were on site and right from the start. So an education was had by both of us as to how you organize the situation. You were dripping wet. I mean, you had guys rotating in and out. You had water there. I mean, everybody had a task. Everybody had a function to help in, and then you had the main guys bursting in a window on the second floor, getting into the heart of it. And, you know, we've talked, but it was an eye-opener, and even a fire of that smaller magnitude that you knocked down in 25 minutes certainly posed opportunity for several, you know, of your crew to get injured. So it was, like I said, a real eye-opener. I mean, the other aspect that we want to stress, I think, is that in Rocky Hill, our public service departments coordinate together. So ambulance, police, blockading the road, getting everything organized so the trucks can roll in unimpeded, get to the site. It was an excellent case study. I don't know how other way to put it. And I almost wanted to videotape it so you go back over and see how people started coming in and then taking command of their area. And it was extraordinary. So I commend you all for participating in unison and then bringing in East Berlin and Newington.
Thank you, Ed.
Moving on to ambulance, excuse me. We've got an ambulance report.
The ambulance for the month of July had 421 calls, which brings us to a total of 2631 for the year so far. We had 6 canceled calls, 3 of them they had no patient contact, and 1 that was actually we were canceled prior to arrival. We had 4 lift assists for the month, 22 actual patient refusals, no transports. We had 1 opioid-related transport for the month of July and 1 cardiac arrest for the month of July. We also did a community standby in Newington for the extravaganza cover for medical coverage. We did 99 hours of training for the month, which was 3 Thursday. We had 3 meetings this month in July. 1 was on the new ambulance cameras, Aztec. We have new 360 cameras on the ambulance that we were training our members on. We had an ALS interventions class with the paramedic teacher going with the EMTs from Rocky Hill going over calls. And we also did shock and bleeding. For the month of July, we had 1 new member, and the members are listed below. We have 44 active riding members, associate members, non-riding were 9. We have 11 new people that are still training. We should have a couple more of those cleared for September. We have 3 that are medical leave, 4 that are still in college, and 1 that's in Germany on military leave. The rest of the report's pretty self-explanatory. The Aetna response times and the breakdown of how many calls that they did for the month are there. Then on the next page, it shows our calls from 2021 against what we've done so far. For July this year, we did 127. Last year, we did only 99. So it's been fluctuating up and down depending on the month that we have that's going on. And then the rest of the report shows the breakdown of the types of calls that we have for back pain or shortness of breath or any kind of depression, difficulty breathing. That's all listed on the last 2 pages of the report there to break down for you guys to let you know what's going on.
Great. We appreciate getting the report in the packet, too. That gives us time to look at your detail. Counselor O'Sullivan.
No questions. Thanks, Brian.
Counselor Prakash.
Yeah, so this is really now nice and detailed, report, and I second, Ed's thoughts on this. That it's good to have this in the packet. One thing I'll say, we can, if as and when we can take the next step, because this is really good data to actually put out visually, because I can see all these reasons you have listed here, and they can be really in a nice chart. I mean, and I'm not saying next month, but I think that could be the logical next steps like we have for the police. I think,
Okay.
yeah, I think you can
The
just.
problem that we had was the system that we use that generates these reports doesn't do charts. It prints it this way. So what we do is we go into our dispatch thing that we have, and we print out the reports. And there was a lot of times you can either pick like charts or just the graphics with the
Right.
information on it. We have asked in the past for him to look into something for the charts, so he was still looking, as far as I know.
Yeah.
But I'll see what we can do, because if not, we have to take it out of one system, enter it into another to be able to generate a.
No, I hear you, and I don't mean to. I always said this
No, I know.
to the chief as well,
Yeah.
that I don't want to more work on your plate.
Right.
But it's just a matter of. And by the way, once we set it up, I think you would like them too. Probably it'll be just better way to look at it.
Okay.
I mean, the charts we get for the police now are they are. I mean, I think we will agree as a committee here that they look really good, and it's a really nice way to, kind of get insights
I'll let 'em
rather
know.
than just the numbers. Yeah.
I'll let him know, no problem.
Yeah. But thank you. I mean,
problem.
not necessarily next month, but
I know.
whenever you can get to it. Yeah. Thank you.
Associate member non-writing 9. What do non-writing members do?
Well, we have people that do just training that are retired. We have buildings and grounds. We have a secretary that comes in and does our work. It's people that actually don't ride the ambulance. There's, there's training people. There's, like I said, there's the secretary. There's a person who sets up for the meetings, gets the food, gets the meetings all set up for our training and stuff like that. So
Okay, understood. All right. That leads us over to police, the police report.
Okay.
Buster.
For the month of July, there were 3,803 calls for service through the dispatch center. Police department had 38 criminal arrests for the month. We investigated 23 motor vehicle accidents. 2 were with injury, and the other 21 were non-injury. There were 9 DUI arrests for the month, a total of 110 infractions, motor vehicle infractions issued, and an additional 312 warnings issued, for a total of 422 motor vehicle stops for the month. Participated in 5 community service events, and our training hours for the month were 331. 2 other categories that we've been tracking here the last few months: motor vehicle thefts. We had 2 for the month of July, and pretty much for the year now we've been running consistent with averages that we saw in 2019 prior to the pandemic. The other area that we've been concentrating on is the theft of catalytic converters. And unfortunately, that's kind of been up and down. We had a downward trend the last few months. We spiked a little bit in July. Ironically, that law went into effect July 1. Didn't seem to have any effect whatsoever. We had a total of 12 catalytic converter thefts for the month of July. However, I can tell you that a suspect has been developed, and we believe he's responsible for the bulk of these in our town as well as surrounding towns. So we're working with detectives in the greater Hartford area, applying for arrest warrants, working with the prosecutor, and it's very confident we're going to get an arrest for the bulk of these. And again, intelligence provided to us in part by the auto theft unit, which led to developing that suspect. They did a lot of work, used DNA, et cetera, so hopefully we'll be announcing that shortly. In terms of staffing, we do have one dispatcher vacancy. A dispatcher recently resigned. It was anticipated. She's pursuing a career in the private sector. So that resignation went into effect the 13th of this month. So we'll be posting for that position and beginning the process to fill it. No vacancies on the police side, no personnel out on COVID or injury leave, so that's all good news. There's no regional auto theft task force report this month. They're now supplying the data to us bi-monthly, so we'll get one for next month, and it'll cover 2 months. I think that's all I have on the police side.
Counselor O'Sullivan?
No questions. Thank you for the report, Chief.
Counselor Prakash?
Thank you. So, Chief Custer, one quick question on, there was an incident at the VA, which I came to know through social media recently of a breaking and entering, I guess, and they, some money was stolen, and it's still under investigation. So if you don't have the facts, that's okay. I just wanted to bring that up because I saw some media reports of that.
Yes. Yeah. I'm aware of it. It's being investigated. I don't really have any additional information on that. I know it's active. We're still working on it.
Okay. No, thank you. And in the spirit of what the chairman said here, I had that, opportunity to have that ride along 10 days ago. And I would like to say, just in addition to what the chairman already said, that I do think we have a working relationship in town between all our first responders, which is remarkable. And I think we need to talk a lot more about community policing as it exists today in our town and as a model for like our state. The things I saw during the ride along, I was there like for 4 or 5 hours, and our officers are very much engaged with the community. I saw stops like leading to fixing car seats of children car seats, the back seat. I saw our cops like supporting the EMTs, the ambulance, and the fire ultimately, right? So I guess I don't know if I should say lucky, unlucky, whatever. I wish these incidents don't happen, obviously, but I had the sampling of a day that our frontline officers experience, right, on their job, and I would say I had a really good sense of what they do here and experience, right, and how they interact with the community. So I mean, again, like just to thank the RHPD for giving me this opportunity to like do that ride along, and then seeing our first responders like fire, ambulance, and the police working together so well. So thank you for that.
Thank you.
Chief, yeah, on that ride along, there's no question, 2 very fine patrolmen, and yeah, they're two great patrolmen, and you say you have others, so that's
Several.
that's something to be said. And then we did really hit the trifecta, I guess, because we did go along on the ambulance call, and then we did some traffic stops, traffic violation stops, and some community service, And these guys really like what they're doing. Happen to be guys this time, but these two patrolmen really enjoy what they're doing and know how to really work with folks and situations. So that's pretty cool. I have an email that came in that I forwarded to you regarding Dividend Road and speeding. I guess you're on that. We
Yes.
forwarded that over. So, I mean, like the charts are saying with regards to catalytic converters going up and some of the arrests, for certainly a high in terms of criminal arrests, and then some of the speeding. I mean, thank God we have you out there. We have the extra patrol hours out there and men, but it seems to, they seem to be finding a way to screw up out there on the street continually. So, we're happy that we have you there, but we are, we have to follow the numbers, and we are seeing that they're still there. So we're concerned about that. We want to follow that, and we appreciate everything you do to inform us regarding that. The license plate reader technology, is that in place?
As of this time, the company that we contracted with is working through all the legalities with the utilities for mounting hardware on utility poles. I guess there's some legalities they have to work through with cable and whoever else hangs on those poles. So I've been warned by my chief colleagues that this is the most time-consuming aspect of launching an initiative like this, and said don't be surprised if it takes several months before all that's ironed out and they can actually get to installing the equipment and using it. So I'll keep you updated as I get additional information, but that's where we're at right now.
Okay. All right. And again, kudos to you three chiefs, because you must be setting the example at the top for the rank and file to be working together. So we want the public to know that. We'll continue to reinforce that. Councilor Sullivan, were you thinking of another question?
Yeah, just one question on the license plate readers, and the term, it sounds literally like it's this camera that does a zoom in on the license plate, but I assume, what kind of image is it going to capture? Like, will it be able to get, for example, a good view of the people who are driving, that kind of thing? Or what kind of data will we actually get from those readers?
It's going to be pretty much restricted just to vehicles, exteriors, and license plates. It's very rare that you can get from that distance and mounted on a pole and an accurate photo of a driver or occupants. And that's okay, because we're just interested in vehicles and plate information. So that's basically what it's going to capture.
Okay, thanks.
I think emergency management is out this evening, right? So we won't have a report on emergency management.
No report.
I mean, I can tell you that the cooling centers were activated, and that we did monitor them. I was in touch with Emergency Management Director Stephen Pendle. He was in connection with us and the mayor, and it seemed, because there was no power outage during this drought heat wave, I think that was our saving grace, because the attendance at the cooling centers was kind of like a normal flow of the usual shuffle in, the usual shuffle home type of thing. So, but we did have the cooling centers open, and that's probably it for emergency management at this juncture. I don't think anybody has anything to add there, right? So with that, we're moving on to the Central Connecticut Health District update, and welcome, Charlie Brown.
Hi, how's everybody doing? So as an update for Rocky Hill, for case counts for COVID, we're currently at cumulative cases as of this afternoon at 4,560 cases. Cumulative fatalities for the pandemic stand at 152, and that's been pretty steady. Our percentage of positivity rate right now is about 10.8. It was 10.8 this afternoon, and it's been steady between 10 and 12% for some time. Numbers recently have been staying fairly steady on a slight incline for a number of cases, but it's definitely a lot lower than what we'd seen previously, but COVID is still definitely out there in the communities. Last week, as was mentioned before by the other chiefs, they have redone the quarantine and isolation guidelines from CDC. Really have pretty much done away with quarantine for exposures and have really focused on isolation when somebody is symptomatic. So I would recommend that if folks, if they do happen to test positive or if they do happen to have symptoms that are consistent with COVID, get yourself tested. And then if you do test positive, I think the isolation period now is down to 5 days. And then if you're fever-free for 24 hours, then you're able to come out of isolation with a mask as long as your other symptoms are improving. So, you know, we're dealing, I think, coming back down from a pandemic level into that transition phase into endemic disease, which is more going to, hopefully going to be more seasonal than anything else. We do know that the FDA has cleared the pharmaceutical companies to update their vaccines. So we're expecting this fall for a new vaccine to be out that's going to address the Omicron virus, which, you know, is what's primarily out there in the communities right now. So we'll see hopefully a much more effective vaccine because it should match up with the virus that's circulating. In addition to all the fun that we have with the pandemic and COVID, we've been transitioning into responding for Monkey Pox. We've had actually cases, a couple contacts with people who've had Monkey Pox within our jurisdiction, the 4 towns. So we've, you know, been following up with those individuals, monitoring their status as they progress through their disease, and just assure that those people that have been exposed, that they're, you know, doing okay and not contracting the illness or spreading it around. So, you know, hits just keep on coming from the health department standpoint. 2 other things to just to let you guys know. We're coming up on flu season here. Our district is actually doing a lot of planning for flu clinics. We're probably going to go back to the walk-in clinics as we've done previously, but we are going to have 2 drive-up clinics. They're going to be, all of our clinics are going to be done by appointment through our website. And we really do, you know, hope that people take advantage of this year wherever you get a flu shot. Indications from the Southern Hemisphere are really saying that it's been a pretty bad year down there for flu. And we've had some good years here while COVID has been going on because of the masking and social distancing. So right now we're kind of looking at this flu year as being kind of that virgin field for a virus to take advantage of. So we really do encourage everybody to get your flu shot this year, anywhere that you can get it, just so that we don't see a lot of flu running rampant in the communities. Last thing, we've had a couple of additions to our staff here recently. We've got a public health nurse, Lisa Coakley, who's been working with Betty Murphy, our health educator. They've been doing an outstanding job getting information out about COVID, about monkeypox, and a variety of other public health topics. And they've been really hitting the social media hard. So if you don't follow our social media with Facebook or Instagram, please check it out, because they are putting out some good information on a daily, sometimes hourly basis. So that's my story, and I'm sticking to it, and we'll welcome any questions that you folks have.
Thank you, thank you. All right, Councilor O'Sullivan.
Yeah, forgive me if you already said it and I missed it. Did you say that the flu shot for the coming fall is available now or coming soon?
Well, it's coming soon. So we're actually planning our flu clinics. We do, you know, flu clinics in all 4 of our towns every year, where people can walk in. We have mass vaccination clinics that we actually do to test our plans for emergency preparedness. And the drive-through clinics we've done over the past couple of years with COVID, just to kind of make sure that the social distancing, and those have been pretty popular. So we're actually going to continue doing those. Our clinics generally happen in October, but the flu shot, you know, I'd be surprised if there's probably not flu shots coming out here in the next couple weeks from CVS, Walgreens, and those folks. They generally get a jump on us because of the volume of vaccine that they order. we try to stick with where CDC's recommendations are to actually get your flu shot in October, because by the time, if you get it in October, by the time it takes, hold in your system is around the time frame for November and the holidays to have optimal protection during those winter times and gatherings that we all take advantage of.
Thank you.
Counselor Prakash.
Charlie, two questions actually. So number one, can you talk a little bit about monkeypox and generally what should somebody be looking for? What are the preventative steps anybody can take? I don't think this information is out there. I mean, it's out there, but I don't think people talk about it as much because there's some COVID fatigue, obviously.
Yeah.
Through right? So we don't want to talk about another, disease, I guess. That's just normal human beings. That's just so I just want to make sure, if you have a 2-minute version of it, if you can talk about that a little bit. And then I have a question about the vaccine which is coming out, the Omicron one.
Mm-hmm.
Is that, when are people going to start getting it, or is there a schedule out there for that yet?
I'll answer the vaccine question first because it's actually really quick. The FDA has basically asked the pharmaceutical companies to develop a new vaccine targeting the Omicron virus. They're projecting that it should be ready for this fall. So that's, the only target that we've seen. Haven't seen any trials or anything like that. But that supposedly those are in development at this point. With respect to monkeypox, yeah, it is a different disease, and we're not, even though we have reached the public health emergency level, we haven't gone global pandemic with respect to this. Monkeypox is quite a bit different than coronavirus. Mostly transmitted by skin-to-skin contact, that you can contract the disease from soiled garments or linens, things of that nature. So, what we're primarily seeing right now is, a lot of transmission in the LGBTQ community, with men having sex with men, and folks that are bisexual, being about 96% of the cases. They have had some cases with respect to, children and others, but primarily it's within that group. Monkeypox itself is similar to smallpox, chickenpox. It does raise a rash, on the skin with pustules that come up over 2 to 3 weeks. So, it is something that you can actually see physically on the individual. But people are infectious prior to those pustules becoming, apparent. So a lot of what we do is information, to the general public to be aware that the disease is out there, that if you do just start to develop rashes, fever, to see your doctor, especially if you're in one of the at-risk communities. CDC and I think the state health department has been very good with working with affected communities. We had a bad situation back in HIV where there's a lot of stigma about this particular disease. And really it's not anything, to do with that population. They're just more affected because of the way that it's playing out at this time. So we've been very active on monkeypox here in the last few weeks, where we've been contacting, for example, all of our hotels and motels to make sure that they have information about soiled linens, how to handle those, especially in some places in the district that we know that sex trafficking and things like that happen. So we've been trying to get information out there about that in a variety of languages. And we also have a monkeypox resource page on our website at www.ccthd.org. And you can look at monkeypox and find a variety of resources from general information down to clinical diagnosis.
Okay. Thanks, Charlie.
All right, thank you for your report. Good seeing you. And now we move on to new business. I don't believe we have any. Ray, do we have any new business? No? No, we don't. Other?
Move to adjourn.
Motion to adjourn?
Second.
Okay. All in favor? Aye. Thank you.